it's your nurse Ariel. How are you?
Good, how are you doing?
Good. So I am here to go over some discharge instructions. I know you'll be going home in just a few hours. So is now a good time to go over this?
Yeah, absolutely.
Okay, great. So first off, we're going to talk about bleeding and pericare. So you had a C-section, but there's still going to be a lot of bleeding, as you know, as you've experienced in the last couple of hours that you'll be experiencing. So what you can kind of expect for the next couple of weeks is that you will have bleeding kind of like a light period for the next 6 weeks, like a really long period. As you know, it's kind of been heavy and it will continue to be heavy for the next couple of days, but it will get lighter and lighter as it goes on. However, if you saturate a pad in 1 hour, if you have any large clots, like anything bigger than the size of an egg, you need to call the ER and come in, because those are signs of hemorrhaging, and those are not good things.
Okay, I'll do that.
So I'll be sending you home with a peri bottle that you've kind of been using to just wash the area down and keep it nice, clean, and dry. So what's really important is that for the next 6 weeks, nothing goes in the vagina, no tampons, no sex, no douching, none of that.
Okay.
And so whenever it does come time for you to return to intercourse, just make sure that you're using contraception, because you don't want to accidentally get pregnant and not realize it, because you're breastfeeding. Is that what you said before?
Yes.
Okay, yeah, that's what I thought. So you may not have a period during this time, but you could still ovulate and not realize it. So having contraception is important. Breast care. So you want to make sure that you are washing your breast, because I know you mentioned before that you're breastfeeding. And also you might experience a little bit of leaking. I'm gonna send you home with some of these breast pads that you can kind of put in your bra, just to not like accidentally soak through, things like that. And these are really helpful. Okay. So you'll have pads for here and you'll have pads for there.
Oh, that sounds great.
And so one thing you want to make sure is that you wash your breast right before you feed the baby, and wash your hands, because this is how the baby eats, and so we want to have good hand hygiene and keep the area clean. As you know, you want to wear a supportive bra, no tight fitting sports bras or anything like that. As your milk comes in over the next couple of days, you might start feeling what we call engorgement, where you feel really heavy, your breast might feel really tender. This just means that you're full and the baby needs to nurse. So the best thing you can do is just to nurse the baby. But if you need a little bit of help with that, you can also kind of take a hot shower, and that will help loosen things up.
Okay.
However, something I wanted to go over are signs and symptoms of mastitis. So this is like engorgement, but more so where it becomes an infection. Okay. And so where you can kind of tell the difference in that is that you might start experiencing flu-like symptoms or fever or body aches. These are things that are not good, and that you'll need to call your doctor, and you might need to get on antibiotics for. So you can continue to nurse your baby. That's the best thing that you can do. But you'll just want to watch out for those things. Okay, any questions on that?
You mentioned that I might not have a period for a long time. Do you know about how long until the period will come back?
So it really just depends on your hormones and how you're going through with your breastfeeding. Everybody's different, but if you are continuing to exclusively breastfeed, it could be many months that you go without a period. So don't be surprised if that happens. But also if it returns, that's completely normal too. So it could just depend, but don't be surprised if it is for many months.
Okay, sounds great. Thank you.
Medications. So continue to take those prenatal vitamins just like you were when you were pregnant. All of those nutrients you need for yourself as you're healing, and same thing for the baby as you're breastfeeding. Okay. We'll also still send you home with some pain medications. So we'll send you with an 800 milligram ibuprofen. Just take that as needed. Your pain should get less and less as it goes on, but if you do need that, you can take that, and that's safe for you to continue nursing with. Okay. However, if there's any other over-the-counter medications or things that you want to take, just give the doctor a call, or call your OBGYN office or the pediatric office. Just call and make sure that everything is safe for you and the baby. Most things are, but just call and double check before you take anything. Okay. Also, if there's any signs and symptoms of itchy throat or pain somewhere, that might be a sign that something else is going on. So before you just take medication for it, just go ahead and give us a call. Okay.
Sounds perfect.
Activity, walking is just about the only exercise you need to do right now. Getting up and moving around, getting the blood moving is going to be the best thing. So don't do any crazy Pilates or weightlifting. For right now, especially for the first 6 weeks, taking care of yourself, resting, and walking is going to be the best thing you can do. If you also want to do some Kegel exercises to kind of start strengthening those pelvic floor muscles, you can do that as well. So since you had a C-section, you're not going to be lifting anything over 10 pounds for the next 6 weeks. So I know that can be kind of tricky with a baby and a car seat. So do you have somebody at home to kind of help you with moving things around and stuff like that?
Yes, I'll have somebody to help me with that.
Great. Which also brings me to the point of driving. Since you had a C-section for 2 weeks, we don't want you driving. But I know you have some appointments that you'll have to go to for the baby and things. So will you have somebody that you can get transportation to these
Yes, I'll have
appointments?
somebody to be able to drive me to the appointments.
Okay, wonderful. Okay, so now let's talk about your C-section scar. So the best thing that you can do for this is just to keep the area clean and dry. Look at it every single day to make sure that there's no changes over the time. It should be healing. The edges should always stay closed, and if anything pops open, let us know. If there's any drainage or discharge or bleeding, let us know, because that shouldn't be happening.
Okay.
When you're taking a shower, you can just let the water kind of roll over it, but don't vigorously scrub
Right,
or anything like that. But if you do see any of those signs that I talked about, swelling, redness, drainage, those are signs of an infection. You need to call the doctor immediately. Okay. So also one thing that I'll send you home with is these underwear here. So I know you've been using things like this in the hospital. What's really important about this is that you don't want to have any low cut underwear that could be rubbing on that C-section scar. You want something that's going to go nice and over it. So these are cotton that you can put your pads and things in, and what's great about these is that they're disposable. So every time you go to the bathroom, you can wash up and then you can just toss these out. So I'll send you home with some of these.
Okay, perfect.
But you don't want any extra irritation. It could bust anything open or anything. Okay, so we already talked about some other signs and symptoms of infection for mastitis or your C-section scar, but some other things that you might see in other areas would be signs of a UTI. So if you're going to the bathroom, urinating, and you have any pain, that's not normal. You need to call your doctor if you're experiencing any burning. Okay. Also for your vaginal discharge, it should be bleeding and it should be getting lighter. But if you're having any discharge that is looks like pus or it smells really bad, that also is not normal. You'll need to call your doctor about that too. Okay. Same thing for your nipples, if they're cracked, if they're bleeding, if you start getting red streaks on your breast, or you just start feeling like you're having a fever, again, call the doctor. Okay. Postpartum depression. So this is a very stressful time. Your hormones are all over the place. It's normal to kind of have some mood swings, maybe start crying about things that you never thought you'd cry about before, and you kind of feel all over the place. That's okay. But what isn't normal is that if you start feeling like you're not connected to your baby, or you're feeling senses of hopelessness, or just feeling like you're losing control, those are signs of postpartum depression. And so you'll need to make sure that you have a support person, somebody you can call, and you'll also need to immediately call your doctor, because we want to make sure that you're being safe, that your baby can be safe. Okay. So do you have any questions on kind of the differences between the baby blues versus when it's actually progressing into postpartum depression?
I don't think I have any questions right now.
Okay. Do you have some people at home that can support you and help you during this time, because it is a stressful time?
Yes, I have a good support system that can help me. Okay,
great. So as we already kind of talked about, you'll return to your OBGYN in about 6 weeks. So they will be calling you to set that up soon. Okay. So just to kind of recap what we talked about, signs and symptoms of things that require immediate medical attention. So a temperature over 100.4, call the doctor. If you have any pain in your calves or swelling, that could actually be a sign of getting blood clots. So just be kind of looking at the swelling of your legs and if you're having any pain. Same thing if you have any worsening abdominal pain. Your pain should be getting better. So if it's starting to get worse, call your doctor because that could be a sign of infection. Headache, blurry vision, things like that. Also call your doctor because those are not normal. Okay, so now we'll talk about the baby. So you told me before that you're breastfeeding, correct?
Yes.
Okay, so for breastfeeding, you'll kind of be feeding on demand. The baby is not on the schedule, so you really can't expect to be feeding on a very strict schedule. So you can expect to be feeding the baby about every 2 to 3 hours, so that'll be about 8 to 12 times a day. However, it might be more frequently than that, so don't be surprised if she goes through little growth spurts and is hungry and feeds more frequently. So she'll be regular all the time with her feeding.
Good.
Okay, and then for her normal daily output for the baby, she should be having at least 6 wet diapers during the day and about 3 or more bowel movements a day for her breastfeeding. And these stools might appear kind of loose. Don't worry, it's not diarrhea. That's expected for a baby who's breastfeeding.
Okay.
For umbilical cord care, you'll just want to wash the area with soap and a cloth every single day. Don't use alcohol and don't clip it, just let it fall off naturally. For bathing and skincare for the baby, she doesn't need a bath every day. 1 bath about every 2 to 3 days. That will be all that she needs because she's not really getting dirty. But you can wash her face and wash around her neck and things if she gets a little messy while she's eating.
Okay.
But then you'll just be kind of giving her a bird bath for the first, 12 to 14 days or just until the umbilical cord falls off. And once that cord's gone, she can go ahead and do like a little tub bath for like the little baby tubs if you want to do that.
Okay.
But until then, just use washcloths. Let's see, shaking baby syndrome. So I know you've probably heard of this before. But no shaking the baby. It can cause really, really terrible brain damage to the baby. So if you ever feel like you are at your breaking point and you've had more than you can take, the best thing you can do is just lay the baby in a safe place like the crib or the bassinet. Make sure they're safe, and then you just walk away and take a moment to just breathe and get yourself centered. Okay.
I'll do that, absolutely.
So we'll talk a little bit about SIDS and safe sleeping practices. Have you heard about SIDS before?
I have heard about SIDS.
Okay, so the best thing that we kind of educate on for preventing SIDS is safe sleep practices. So you want to lay the baby to sleep on their back, not on the side, never on their belly. You can do tummy time when they're awake, which is important, but not when they're sleeping, only on their back.
Okay, I understand.
And then in the crib, no blankets, not even stuffed animals, don't have the crib bumpers. I know those were popular in the years past, but right now everything just needs to stay clear of the crib because anything in that crib could be cause the baby to suffocate. Okay. And also a thing that is important for SIDS is the ability for the baby to regulate their temperature. Right now, they're little, they're not able to regulate their temperature, so you're gonna have to make sure you're paying close attention to know if they're too cold or if they're too hot. They can't sweat, they really can't shiver, so you're just gonna be paying attention to the baby to kind of keep the environment set to an appropriate temperature. The room set to 68 to 72 degrees.
Okay.
Dress your baby appropriately to how you're dressed, if it's hot, if it's cold. Although they can lose their temperature, they can lose heat a little bit more quickly. So keeping a hat or a little beanie on them and socks and things like that will help keep them warm.
Okay.
Skin to skin is also a really great thing you can do to help them regulate their temperature as well.
Okay.
So do that multiple times a day. That's wonderful for the baby. Their normal temperature is 98.6 to 99.5. If their temperature is over 100, you need to call the doctor because that could be that they're experiencing a fever.
Okay.
Do you know how to take the temperature for the baby?
I do.
Okay, so you will be taking it underneath their armpit.
Yes.
I know some places will recommend taking it rectally, but I know a lot of parents don't really feel comfortable doing that or afraid they're going to hurt the baby. So it's perfectly fine for you just to take the temperature under their armpit, okay?
Okay.
Newborn jaundice. So jaundice is whenever the baby might look a little bit yellowy, where they almost look like they have a tan, but this actually isn't a good thing. This is actually a very serious condition. This actually will kind of peak around day 3. They might look very, very yellowy yellowy or orangish. They might even have a little bit of yellow to their eyes. And if they start showing those signs, you'll need to call your doctor, because we need to make sure that those levels don't get too high, because they can be toxic to the baby.
Okay.
But one thing that you can do to kind of help with those levels is to help the baby get some vitamin D and get some sunshine. So
Okay.
when you're at home, sit by a window, get some sun exposure. Don't get direct sun exposure, because it's not good for their skin. But keeping them hydrated and letting them kind of poop it out is really the best thing that you can do. But at that 3-day mark is usually whenever you'll be going to the pediatrician for the baby, and they'll be looking at those levels then.
Okay.
But until then, if you see any changes, call your doctor.
Yeah.
Okay, car seat safety. Do you have a car seat with you here?
Yes, I do.
Okay, so you'll be keeping the car seat rear facing until they're 2 years old, and make sure that the straps are nice and snug, and that the clip is right there at the level of their armpits. Okay. And no blankets or jackets in the car seat.
Okay.
Okay, and then we'll kind of go over one more thing: infection control for the baby. No crowds for 6 weeks, so don't be taking the baby out to crazy parties. Their immune system is just really little, and they're still developing, so you want to keep them safe. And then also you'll want to wash your hands frequently. Every time you go to the bathroom, obviously, but every time you feed them as well. I know it can get crazy and busy, and you'll do one thing and try to multitask, but make sure you're washing your hands. Okay. We'll talk about airway clearance for the baby. So I'll also send you home with this little suction device. You can use this to kind of suction their nose if they get a little gunky and some boogers. You can use this to suction their mouth if they have a little bit extra drool or things. Use this occasionally, but if you feel like the baby is starting to get congested and you think that, they might have something else going on, definitely call your doctor. But for occasional uses here and there, you're welcome to use that little bulb syringe. And we already kind of talked about some of these, but the signs and symptoms of infection for the baby. So persistent crying. Obviously the baby's going to cry here and there, but if it's like ongoing, that's a sign of pain. If the baby is more lethargic than normal, that's not a normal sign. Call your doctor. If they have a low body temperature, if they're starting to get more pale, if they're like excessively vomiting, or if they have any drainage from eyes, ears, nose, vaginal discharge, anything going on with the baby, call your doctor. Okay. And then symptoms that require immediate medical attention, very similar to what we talked about for you, but if there's a temperature over 100 for the baby, if they have any coughing, congestion, any hives, consistent crying, and that discharge. Okay. And then you'll follow up with your pediatrician in 24 to 48 hours.
All right.
So I will give all of this to you because
Sounds great. Thank you so much.
Yeah, you're welcome. Do you have any questions for me?
I think that's it. I really do appreciate you explaining everything to me.
Okay, wonderful. Well, you take care, and then we'll get you out of here in just a few hours, okay?
Sounds great. Thank you.
All right, thank you.